7,968 deaths are reported yearly as a result of cervical cancer. The World Health Organization says the human papilloma virus is responsible for about 95% of these cases. This is why the World Health Organization, National Primary Healthcare Development Agency, and some partners are introducing the human papilloma virus vaccine in Nigeria. This is our focus today on sound health. I am Olasunbo Mudupe. The program continues in a moment. Please stay tuned. It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Boma Otobo, Adolescent Health and Human Papilloma Virus Vaccine Introduction Consultant with UNICEF. And she is going to tell us what the HPV vaccine is and how the routine immunization will take place in Lagos and Nigeria. Good evening, Boma Otobo, and thanks for joining us.
Good evening, and thanks for having me.
All right, Boma, thanks for joining us once again. But before we go into what the HPV vaccine is, what exactly is a human papilloma virus?
Okay, so the human papilloma virus is a virus that affects the cervix, which is the lower part of the womb of a woman. It can also affect the in the organs, the penis, and can also cause some skin infections, genital warts, and other cancers. It affects women, especially young girls who have been exposed through sexual contact. It's a sexually transmitted infection affecting young women, like I said, and also for the young males, it can also affect the penis. It can affect the genitals, coming down with genital warts, and there are other cancers that it causes, and things like oral and throat cancers can also be caused by the HPV virus.
All right, it's a good thing that the World Health Organization has partnered with other states and countries to introduce the HPV vaccine. Why are we choosing, or why are we just focusing on the preteens and not the entire women?
That's a good question. The virus starts when a teen, for instance, is exposed to it. And the best time to prevent this infection is when the child, or I don't know if I should call that a child now, when our young girls, for instance, are not fully sexually active. So that's why we prefer to catch them when they are between the ages of 9, 10, 11, 12, up to 14 years. After which, once they become sexually active and the virus is contacted, you will not be able to prevent that disease further because they have already contacted the virus. So we're catching them just before they become sexually active.
Okay, so can girls or women that have been sexually active also benefit from this vaccine? Are they exempted from taking this vaccine?
For now, the federal government and the partners that are supporting this introduction are targeting girls aged between 9 and 14 years. For obvious reasons that you will recall that the quantity of vaccines required would also be very large if we were to target beyond that age group. And so the best time is before they get exposed. So we're limiting it at this first introduction to the ages of 9 to 14. And thereafter, we are intending to take it into the routine system where only girls aged 9 would be able to access the vaccines.
All right. Boma, thanks for that explanation. In your introduction earlier, you said the human papilloma virus affects both the male and female organs. Yes, genital organs. Now, why are we focusing on just girls and not just boys as well?
So the major cancer we're trying to prevent, based on the data we've seen from the public health, is the cervical cancer. And we all know that it's only females that have the cervix. The males do not have a cervix, but can also transmit the virus when they carry it. So we're targeting the women because the end game is definitely to eliminate the cervical cancer.
All right. How many doses are we looking at, and when is this schedule going to begin?
So for this introduction, we have the Gardasil 4 vaccine, which is the best among the range of vaccines that can prevent the human papilloma virus. We are using a single dose vial, which means once the dose is given, the recipient is protected and would not need to get a second dose.
Okay. Yeah. All right. So when is this vaccination or the campaign going to begin in Nigeria?
So for Nigeria, we have 2 phases. We are targeting 16 states in the first phase, and that would commence on 25th of September and run through the 30th of September. Thereafter, it will become available in the public health facilities for those who would have been missed in the current campaign in those 16 states. The second phase will commence anytime from February 2024 for the rest of the states that could not access in this first phase. And they also would be targeting the same age range of 9 to 14 years. So for Nigeria, we have up till the end of 2024 to have reached and covered the entire target that we have. Then from 2025, the vaccine will be available in all the public health facilities in Nigeria for girls that are aged only 9 years. We will not go beyond that age group for the moment. Yeah.
All right. Is this vaccine free? Are we expected to pay any amount to get vaccinated?
That's a good question. We know that the vaccine is available in private facilities and they pay a lot of money. But for us, the federal government and the partners have put funds together and have bought those vaccines and have distributed to the states that are going to introduce. So it's free as part of the efforts to eliminate cervical cancer. So it's free for every client that will work in to the public health facilities through the period, and it's also free for girls that will be visited in the schools and out of the schools. We have some girls too who fall into our target age range. They do not need to pay. They're in the communities, they're in the marketplaces, they are found in the mosques, they are found in the churches. So it's free to everyone that would access the vaccine throughout this period. And once it becomes routinized, it's also free in our facilities.
All right, can a girl who
and the government facilities do not charge a dime for vaccines. Yes.
All right, can a girl who has been vaccinated before now benefit from this forthcoming campaign or schedule?
Now, once the girl has evidence to show that she has been vaccinated before now, she does not need to access the vaccine a second time.
All right. What plans are in place to address myths and misconceptions? Because before now, anything new being introduced into the system, especially health, gets a lot of controversy. So, what plans are in place to address myths and misconceptions, or to dispel myths and misconceptions about this vaccine?
So the federal government, through the National Primary Healthcare Development Agency and partners, have also distributed flyers, posters, and other information, education, and communication materials that gives more information about the vaccine. We have also conducted the media orientation, and that was part of the activities that took place on Friday last week, where the media houses have received information about the vaccine. So obviously we have the anti-vaxxers, yes, but we are not bothered about the misconceptions that they spread, because we put in place a mechanism through the crisis and risk communication unit, and we're making sure that the truth about the vaccine is shared with the public. So definitely when these myths and misconceptions come up, we only just need to confront them with the truth. And then we allow the clients to choose whether to receive the vaccine or not.
Okay, so what about side effects? It is normal to experience adverse effect following immunization. Are there also plans in place? What can beneficiaries do to address such issues?
Obviously, as with any other injectable vaccine, we expect that there will be few cases. We don't expect a large number of people who will come down with some kind of side effects, such as injection, redness around the site of the injection, swollenness, and maybe a slight fever thereafter. We don't expect that it will be so serious, but we have also put in place a mechanism where the phone number of the facility, the head of the facility would be written on the card. So if anyone reacts to the vaccines, which we call adverse events following immunization, they just need to call that number. And if it's very severe, we expect that they should immediately go back to that facility. Or once they call and they have explained the kind of symptoms, they can also be referred to a higher level if the symptoms are of the serious type.
All right, for girls who are yet to be 9, that will be 9 years next year, and for girls who are already 15 years, can they also benefit from this vaccine?
Right now, I would say no, because we're looking at age 9 at the time of introduction. So if they are not yet 9, they cannot benefit. And if they are above 14, they still cannot benefit. So we're sticking to those age groups. It's a multi-age cohort we're looking at, 9 to 14. So anyone above those ages cannot access the vaccines for now.
Is there going to be consequences if someone is sexually active? You never can tell if a girl has been sexually active. Is there going to be consequences for taking the vaccine?
So for every girl that presents at the facility, or we go to meet them at the school, depending on the strategy we use, we're not going to be asking them that question, because we all understand the rights of everyone to access the vaccines. What we will do is to physically examine, as they're looking at them, if they look sickly, we may want to probe further to know the nature of the illness. But for those that will show up, we're not going to start to ask them. However, if they have gone to screen themselves before coming and they're already positive, then we will not need to vaccinate them. But for now, we take it that everyone is coming on a clean sheet, they're not sexually active yet. It's not the information you want to start asking your 9-year-old child if you have become sexually active. So we just take it on a basis that everyone has not become sexually active until about after the age of 14.
kindly tell us once again the benefits of the HPV vaccine aside from cervical cancer, prevention of protection against cervical cancer?
So like we said, there are other kinds of cancers, mouth, throat cancers. We also have genital warts, which is also a high, it's something that is high from the data we have seen. We have penile, anal cancers also that will be prevented by the HPV vaccine.
Your call to action as we wrap up now.
Yeah, so I will just say to clients, especially our mothers who have children aged between 9 to 14, to please take advantage of this opportunity. It's coming to you free. If you were to go to a private facility, I'm sure you will pay a lot of money to be able to access the vaccine. There's no need to worry. You've been assured that the vaccines are safe, they're effective, and that they are cost effective. You don't need to begin to treat a disease, as it's always easier and cheaper, even at no cost, to prevent the disease to you. So our call to action is let everyone be on, or let everyone's hands be on deck. The pastors in the churches, the imams in the mosques, everyone that has a stake in this, the educational sector, the market women, everywhere that we can find children that are aged between 9 to 14, we should encourage them to get access to this vaccine. Because we are considering all the girls within our target age group as having not been exposed to sexual intercourse, we will not recommend that they go for screening. But for other age cohorts, other age groups, who may have been exposed to sexual intercourse and above our introductory age of 9 to 14, from about the age of 30, we would recommend, just like WHO has cancelled, that women should go for HPV screening at least every 5 to 10 years. So there should be a repeat test every 5 to 10 years from about the age of 30. But for those women who are living with HIV, from about the age of 25, they also should go for the screening for HPV. And their own screening should be more frequently done between 3 to 5 years of interval. That would be what we will recommend as well, following the WHO standards.
Boma Otobo, adolescent health and human papilloma virus vaccine introduction consultant with UNICEF. Thank you so much for your time on Sound Health. Thank you, and I'm glad to be with you. Thank you. All right, the vaccines are safe, free, and harmless. Coming up next is Trending Health Report from around the world. Please stay tuned. It is still Sound Health on Lagos Television. More to come in a moment. All right, this is why we say thank you on today's episode of Sound Health. A single dose of the HPV vaccine protects your girl against cervical cancer for life. Make them available. It is safe, free, and harmless. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at HealthTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.